It's the diagnostic process.
Usually kicks off with blood tests. Measuring the serum prolactin level is the first step.
And you mentioned the level itself gives clues.
It does. Mild elevations, say under 100 nanograms per milliliter, (ng/ml), could be due to medications, stress, hypothyroidism, lots of things. But markedly high levels, generally over 150 or 200 ng/ml, really point towards a prolactinoma.
And the really big ones.
With macroprolactinomas, the levels are often much higher, frequently over 250 ng/ml, sometimes way higher. But again, one slightly elevated reading needs context, repeat testing. Considering other factors, it's all important.
So the degree of elevation is a strong hint, but not the whole story.
Not the whole story. Doctors will usually check other hormones too to get the full picture. Thyroid function TSH is crucial to rule out hypothyroidism.
Right.
Then reproductive hormones, LH, FSH, and testosterone in men or estradiol in women. This helps see the impact the high prolactin is having. Sometimes, if other symptoms suggest it, they might check IGF-1 to screen for acromegaly, which is caused by excess growth hormone, another pituitary issue.
Okay, blood tests paint part of the picture. Then I assume you need to actually see the pituitary.
Exactly. Imaging is key. MRI, magnetic resonance, imaging of the pituitary gland is the gold standard.
Why MRI specifically?
It's just very good at showing soft tissues and fine details in the brain. They often use a contrast agent, gadolinium, injected during the scan. This makes the tumor stand out more clearly from the normal pituitary tissue, even if it's quite small. The MRI lets doctors see the exact size, location, and whether it's pushing on anything important, like the optic chiasm, or invading nearby areas like the cavernous sinus.
What if someone can't have an MRI? Like if they have certain metal implants?
Good question. In that case, a CT scan computed tomography of the pituitary is an alternative. It's generally less sensitive than MRI, especially for the microprolactinomas, but it can still provide useful information.
And what about that vision test you mentioned earlier?
Visual field testing, yeah. That's essential if the patient reports any vision changes, or if the MRI shows the tumor is close to the optic chiasm. It carefully maps out their peripheral vision to detect that characteristic bitemporal hemianopia pattern or other deficits.
Okay. And one more thing, pregnancy test.
Absolutely. For any woman presenting with menstrual changes or galactorrhea, ruling out pregnancy first is standard procedure.
Right. Makes perfect